Hey there, welcome back to How to Medicate and welcome to this overview video where we will discuss the differences between personality disorders. I already made some in-depth videos on how to treat some of the specific personality disorders, and for those of you interested, you can find those videos in a playlist in the description after watching this video, of course. For those of you I'm meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because I believe that medically educated people make healthier decisions, which is the whole point of this channel. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. And now quickly, let's get learning. So let's first start with defining personality. According to Google, personality is the combination of characteristics or qualities that form an individual's distinctive character, containing mental and behavioral traits. Personality disorders, on the other hand, are a mental disorder characterized by behavior, cognition, and inner experiences that deviate from social norms and expectations, which can cause considerable personal, social, and occupational disruptions. These patterns may be inflexible and pervasive in many situations, and in some cases, people with a personality disorder don't see themselves as having a problem. This is why they, in some cases, can refrain from searching treatment. Ultimately, this could lead to huge personal problems that may induce other mental health problems, like a depression, extreme distress, and anxiety. A personality disorder typically develops in early childhood and is recognized by adolescents. Which brings us to the question, how are personality disorders caused? And unfortunately, there is no clear answer. However, it is thought to be caused by several different factors. Biological ones, like genetic predisposition, psychological factors like negative life experiences such as trauma and abuse, and social factors like your socioeconomic status. Furthermore, personality disorders are very common. Recent studies have shown that about 6 to 10% of all people have a personality disorder. Among psychiatric patients, it's even 40 to 60%, making it one of the most common psychiatric diagnoses and a major public health concern. Which brings us to the different types of personality disorders. Roughly, they can be divided in 3 clusters, A, B and C, which is done based on similarities. Here it is important to note that personality disorders are diagnosed based on several criteria from a diagnostic manual, the DSM-5. In order to diagnose a personality disorder, someone needs to have most of the symptoms associated with the personality disorder in the diagnostic manual. I will not discuss all of these different criteria as that would take up too much time. However, it is important to note that the specific manifestation of a personality disorder can differ among people. In addition, the symptoms and the amount of complaints a personality disorder might cause is also situational and may differ per person. In this video, I'm only trying to give a broad overview of the different personality disorders. For more information, check out my in-depth videos in the description, ask your doctor, or read the DSM-5. Now let's discuss the personality disorder clusters separately in more detail. Now let's start off with cluster A personality disorders, which are characterized by odd and eccentric behavior. They have a lot of similarities with schizophrenia. The biggest difference, however, is that people with a cluster A personality disorder usually have a greater grasp on reality. Cluster A consists out of paranoid personality disorder, which is characterized by persistent suspiciousness, generalized mistrust to others, and paranoid delusions. People with a paranoid personality disorder are often observing the outside world, searching for threats and dangers to validate their fears and biases from the outside world. Schizoid personality disorder, which is characterized by a lack of interest in social relationships, a tendency towards a solitary lifestyle, apathy, and restricted emotional experiences. The last personality disorder in cluster A is schizotypal personality disorder. This personality disorder is characterized by experiencing extreme discomfort when having a social connection with other people. This can be due to the belief that other people have negative thoughts about them. Furthermore, people with schizotypal personality disorder can have peculiar manners, use unusual words, and dress characteristically. Lastly, they may have a distorted cognition, perception, experience paranoia, and in extreme cases even psychosis. Which brings us to cluster B personality disorders. People with a cluster B personality disorder have difficulties relating to other people. As a result, they can be dramatic and overly emotional in both their thinking and their behavior. Cluster B personality disorder include antisocial personality disorder, which is characterized by a disregard for other people, often leading to deceit, manipulation, or even aggression. People with an antisocial personality disorder can act out of impulsive urges for personal gain, can show a lack of empathy, and a bloated self-image. Next up is borderline personality disorder. People with borderline personality disorder often experience unstable and intense emotions that can change very quickly. As a result, they can have frequent angry outbursts and act on impulses. This could contribute to instabilities in their lives, instability in their self-image, in their relationships, and it could contribute to an altered sense of empathy. Then, histrionic personality disorder. This is characterized by excessive emotions, egocentrism, and attention-seeking behavior. They may show an extreme desire for approval and inappropriate seduction. And lastly, a narcissistic personality disorder. This personality disorder is characterized by a craving for admiration, exaggerated feelings of self-importance, and a lack of empathy. Typically, patients with a narcissistic personality disorder spend a lot of time daydreaming about themselves achieving power or status. Next up is Cluster C personality disorder. They consist out of anxious and fearful behavior and thinking. Cluster C consists out of avoidant personality disorder. People with this personality disorder often consider themselves to be unappealing and therefore avoid social interactions for the fear of being ridiculed, humiliated, or disliked. In addition, they may also experience severe social anxiety, feelings of inferiority, and extreme sensitivity to rejection. The next personality disorder we will discuss is dependent personality disorder, and as the name suggests, people with this personality disorder have the psychological need to be cared for by others. This may also include extreme passivity, severe submission, feelings of devastation when a relationship ends, and avoidance of responsibilities. And the last personality disorder in Cluster C is an obsessive-compulsive personality disorder. This is characterized by perfectionism, the excessive need for orderliness or neatness, and a rigid conformity to rules. Failure of complying to these rules or the orderliness may cause excessive anxiety and fear. Which brings us to the treatment of these different personality disorders. In this video I will only mention the treatment option briefly, however I made some in-depth videos for most of the personality disorder. Check the description if you want to learn more. Now there are many different types of treatment forms which can be used to treat personality disorders. Most commonly cognitive behavioral therapy, dialectic behavioral therapy, and verse training. These treatment options will aim to increase general coping skills, focus on trust and empathy. They can help to improve communication skills, social interactions, and boost self-esteem. It achieves this by letting people explore unconscious factors behind their feelings, which can help to resolve past conflicts that may cause current problems. In addition, there are several medications that can be used when people are experiencing severe symptoms. Antipsychotics can be used to reduce hallucinations, anxiety, anger, confusion, and impulsivity. Antidepressants can be used to reduce mood swings, aggression, and self-damaging behavior. An anxiety medication could be used to reduce anxiety, impulsivity, and distress. These are also used to treat co-occurring mental health problems. So for patients that are dealing with a personality disorder and for example in depression, antidepressants are often prescribed to treat that depression. Ultimately, it's best to discuss all these treatment options with your own doctor to identify which ones are most suitable for you. Now I hope this video was helpful, but if you have any questions, let me know in the comment section below and I will do my best to answer each and every one of them. For those of you that are looking for more in-depth information on how to treat any of these personality disorders, check out my in-depth videos in the description. I also made some videos on several medications. You can find those there as well. I also have a Patreon account which can be used to help to support the channel, which will enable me to make more videos and better quality videos. Thank you Sebastian, who is an Investor Tier supporter, and thank all of you for watching this video. If you did enjoy it, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm posting weekly videos on Monday and Friday, and only about 1% of you subscribed, and I think we can do a whole lot better. I'm trying to reach 100,000 subscribers this year, and you could help me. For those of you that can't get enough, I also have an Instagram account @HowToMedicate. I'm posting there a few times a week, so find me there as well. Thank you all for watching, and as always, I will see you next week with a new video on Friday. Bye bye.